Hey, I'm Terrence Mabry, Program Director of the Wound Care Center at Beaufort Memorial Hospital in Beaufort, South Carolina.
Well, hello, Terrence Mabry.
Hey.
It's nice to have you on the show today, talking about the Program Director for the Wound Care Center here at Beaufort Memorial Hospital. Tell us about your job.
Well, it's a pretty big job. I have a lot of responsibilities. I think the main thing that I do is take care of people. I take care of my employees. I'm here to make sure they have what they need because they're the ones actually providing patient care. I have to take care of the physicians, make sure their doctor's offices get anything that they need, and take care of the hospital because they want to know what's going on and know that people are receiving good care.
That's right. So you have to be well connected on both levels.
Oh, yeah. I mean, I have to have good relationships with pretty much everybody who's involved in making the center work.
Wow, that's exciting. Talk about the Wound Care Center. What is the Wound Care Center?
Well, what we do is we take care of the chronic wounds, not just like a little flesh wound like you might get every day, but diabetic patients who come in, they don't feel their feet, so they might step on something and not know it's there, and it turns into a chronic wound, typically lasting longer than 30 days, or pressure ulcers or things like that. When your regular doctor can't take care of you in his office, you come here to receive more specialized care.
Okay. Now, in speaking about that specialized care and speaking about your training, what training did you need to become a program director here at the Wound Care Center?
Most of my training is more on the business aspect. I'm not clinical at all, so I don't treat patients. So my training, I went to undergrad and I got my master's in healthcare administration. So I learned a lot about the business aspects of healthcare, and that's typically what I deal with. And I know somewhat about the clinical aspects, but I learn from my staff every day.
Really? So. And so you don't have to worry about direct patient care. You're what we say indirect.
Right. I'm totally indirect, but I'd have to make sure that the people who are giving the direct care are doing what they're supposed to do.
Well, and that's really important. Talk about school, because in being a healthcare administrator, do you have to take all of those sciences and all of those maths?
Well, I did. Back in the days, I wanted to be a physical therapist, so I took a lot of those in my undergrad. But in my master's program, when I was learning about healthcare administration, there was no clinical knowledge in there. So it was more about accounting and
economics,
reimbursement, and things like that. Wow,
that's exciting. Now, talk about your inspiration for wanting to go into the healthcare profession.
I guess it's kind of funny. My inspiration for wanting to actually do healthcare was Bill Cosby and The Cosby Show. I used to watch it with my parents every day. But other than that, it's just my family. I want to be successful for them. So that's about it.
All right. Well, listen, that's one thing you have right there. I'm going to talk to you. Being a director of a big facility like this in the Wound Care Center, what about your personal life and your work life, your career? How do you maneuver that?
It's all about time management and priorities. I mean, right now, for me, my number one priority is my work. So a lot of times I'm here late hours, I'm here early, I'm here on weekends sometimes, making sure what has to get done gets done. So you have to be committed to your job or you're not going to be successful at it.
Okay. Talk about the salary. Now, that's the young people always want to know about salary. So tell us a little bit about what that salary range is.
Well, depending on where you're working, if you're working for the hospital or as a department manager, it's going to vary. But probably coming out of school with a master's, I say $50,000 and up,
okay,
depending on location and what exactly your role is.
Wow. So now listen, you've seen another aspect, and this is indirect patient care, as you saw with our nurse as well, Joy Rivers, who's also indirect. So for those of you who don't like to work directly with patients, that hands-on and messing with those wounds, right, this is the kind of job that you would tell them to go after, wouldn't it be?
Right, because I don't have to deal with the stinky wounds.
Wow. Okay, Terrence. Well, let me get you to do one last thing, and that's to give the young people some advice about going into a healthcare profession.
I think the main thing is you got to be committed. You got to be willing to work. It's not an easy field because you're dealing with people and everybody's going to be different. So you just have to stay focused on what you're here for, which is ultimately to make sure people get healthy. So
Okay. All right. And the last thing, we're standing in front of a hyperbaric chamber. And so I want everybody to look at this. Now, you don't operate this, do you?
I don't.
But you have to make sure that it's maintained.
Yes.
Right, okay. And this helps patients. I'd like to get in that in a little bit. But anyway.
Jump on in.
Jump on in. All right. Listen, Terrence, thank you so much for talking with me today.
Thank you.
All right.
Boy, I can sit here all day.